Question is to the Minister of Health and Long-Term Care. Speaker, more than a month after we learned about the errors in chemotherapy dosing, patients are still left with the most basic questions of what went wrong. We've seen a lot of finger-pointing, and it's only getting worse. This week, Marchese, the drug provider, threatened to sue the Windsor Regional Hospital for defamatory remarks after the hospital did its best to communicate the situation to its patients. My question is simple. Does the minister think that escalating conflict and finger-pointing is benefiting patients in any way?
Minister of Health and Long-Term Care.
Speaker, what I can tell you is that my first and last concern has always been for the patients that are affected, Speaker. So that's why immediately upon learning about this underdosing issue, the appropriate steps were taken. Patients were notified. They had rapid meetings with their oncologist, Speaker. They had group meetings where they could get answers to the questions that they, of course, had. We set up a working group with all of the partners around the table who are working through the issues, Speaker. We've appointed a third-party investigator to look at the entire safety of our cancer supply chain, our cancer drug supply chain. That work is well underway. Speaker, we owe it to the patients of Ontario, not just the patients affected by this underdosing, but to all patients that we get answers to the very legitimate questions that they have.
Thank you. Supplementary.
The minister's response would be all well and good if it wasn't simply after the fact that these measures were brought into place. Speaker, Ontario's patients seem to be the ones who continue to be left out of the equation. They want transparency, accountability, and answers of how this could have happened. This week, New Democrats urged the government to grant Ombudsman's oversight over our healthcare system. Because patients need someone rooting for them and asking the tough questions. Speaker, will the minister finally make sure that someone is working for patients and grant Ombudsman's oversight over our healthcare system?